71. A patient with a history of deep vein thrombosis DVT is prescribed warfarin. What laboratory test is essential for monitoring the effectiveness of warfarin therapy? A. Activated partial thromboplastin time. B. International normalized ratio. C. Platelet count. D. Prothrombin time. Answer B. International normalized ratio. Rationale: INR is used to monitor the anticoagulant effects of warfarin and assess the risk of bleeding. 72. In psychology, what defense mechanism is characterized by attributing one's undesirable qualities to others? A. Repression. B. Projection. C. Rationalization. D. Displacement. Answer B. Projection. Rationale: projection involves attributing one's own undesirable qualities or emotions to others. 73. What is the primary function of the kidneys in the urinary system? A. Regulation of blood pressure. B. Filtration of waste products and excess fluids. C. Production of urine with a specific gravity of 1/10. D. Synthesis of red blood cells. Answer B. Filtration of waste products and excess fluids. Rationale: the kidneys filter waste products and excess fluids from the blood, producing urine. 74. A patient is receiving intravenous IV heparin therapy. What nursing intervention is crucial for preventing complications? A. Administering aspirin concurrently. B. Frequent monitoring of blood pressure. C. Applying cold compresses to the injection site. D. Checking the IV site for signs of bleeding or hematoma. Answer D. Checking the IV site for signs of bleeding or hematoma. Rationale: regular assessment of the IV site helps detect complications such as bleeding or hematoma in patients receiving heparin. 75. In the assessment of a pediatric patient, what is a normal developmental milestone for a 6-month-old infant? A. Walking independently. B. Rolling from back to front. C. Grasping objects with the thumb and forefinger. D. Sitting with support. Answer D. Sitting with support. Rationale: by 6 months, infants typically achieve the developmental milestone of sitting with support. 76. A patient diagnosed with chronic obstructive pulmonary disease (COPD) is prescribed a bronchodilator. What should the nurse instruct the patient regarding the proper use of the inhaler? A. Inhale deeply and rapidly. B. Exhale fully before inhalation. C. Administer 2 puffs simultaneously. D. Use the inhaler only during acute exacerbations. Answer B. Exhale fully before inhalation. Rationale: exhaling fully before inhalation ensures better delivery of the bronchodilator to the lungs in patients with COPD. 77. During a prenatal visit, a pregnant woman in her 3rd trimester expresses concerns about lower back pain. What is the nurse's appropriate response? A. Back pain is normal during pregnancy due to hormonal changes. B. It's likely a sign of a kidney infection. We'll run some tests. C. Consider using a heating pad for relief, but avoid medications. D. Severe back pain may indicate preterm labor. Let's monitor closely. Answer: back pain is normal during pregnancy due to hormonal changes. Rationale: hormonal changes and the growing uterus contribute to lower back pain during pregnancy. 78. A postoperative patient is prescribed patient-controlled analgesia PCA for pain management. What is a priority nursing assessment related to PCA use? A. Respiratory rate and depth. B. Blood pressure before administration. C. Bowel sounds and abdominal distension. D. Temperature trends over the past 24 hours. Answer A. Respiratory rate and depth. Rationale: monitoring respiratory rate and depth is crucial to identify opioid-induced respiratory depression with PCA use. 79. In a pediatric patient, what is a key characteristic of age-appropriate communication during a health assessment? A. Utilizing medical jargon for accuracy. B. Directing questions only to the parents. C. Speaking softly and using simple language. D. Avoiding eye contact to reduce anxiety. Answer: C. Speaking softly and using simple language. Rationale: age-appropriate communication in pediatrics involves speaking softly, using simple language, and engaging the child directly. 80. A patient with a history of heart failure is prescribed a loop diuretic. What laboratory values should the nurse monitor closely to assess the effectiveness of diuretic therapy? A. Serum potassium level. B. Blood urea nitrogen bun. C. Serum creatinine level. D. Hemoglobin A1C. Answer: A. Serum potassium level. Rationale: loop diuretics may lead to hypokalemia, so monitoring serum potassium levels